Found.
Officially turn the mic on. Now you can.
Okay, good.
We had-
Mic is on.
Making sure we had all the connections to YouTube this time that we couldn't get done last time. We found all the settings.
Working, right?
Yeah, it's working. Oh, yeah, we're live. So
Oh.
that works good. We're live. We're waiting for the official time clock here to put forward to start the meeting. There's Dave. Oh, welcome. Got Laura, we got everybody here. Got Janessa's in the room. I'm not by myself here. Last month, y'all just all left me and I was the only board member here.
We wanted
So-
to talk about it.
Oh, well, you know, yeah, I was gonna say, you just be all on, just leave all the staff here by themselves.
All right.
All right, we'll call the meeting to order. Thank y'all. So we do have a quorum established to conduct business. So our first order of business is minutes. Oh, I should just say Happy New Year, everybody, I guess. You know, because we're not too far away, but New Year, everybody. Okay.
Yeah. Okay, so happy New Year, everyone. So everyone should have received the minutes for December. And this is just a moment if there's any changes that anyone needs to bring up to the minutes.
Okay.
Mr. Chair, this is Mark Bringelman. I just have a recommendation to amend the minutes under the complaint committee. Anytime the board votes to enter into an agreed order or file a notice, that the minutes reflect, quote, "The committee recommended the board file a notice of administrative hearing and order and formal complaint against the respondent per 201 KR 23:150, section 5(1)F, period. Settlement authority was given to board counsel for a possible settlement agreement and agreed order," end quote. That would read better the action of the board anytime there's a probable cause to believe there's a violation of law. Okay. I've printed that out and given it to board staff and the chair. I hope that's verbally clear. Right.
Do you want us to amend our previous minutes with that statement?
I would recommend amending the minutes and then using that from here on forward.
Okay, all right.
Well, I'll make a motion that we amend the minutes to reflect the statement posted by Mr. Ringleman.
Okay.
I'll second that.
Thank you. Any other amendments? All in favor of approving the minutes as amended, say aye.
Aye.
Hi.
Any opposed?
Aye.
Thank you. All right, thank you, Mr. Reynolds, for that accurate wording. Okay, all right, moving on to operation. Wait a minute. Is leaving the room, and you're wait for him to come back in, because he's causing it over. From out here.
I thought, is Mark leaving because it's his turn? Like, what are we doing? Mark's like, I'm done, I'm not doing this.
No, I ain't doing this anymore. Oh, we crazy. Okay, all right, okay.
Operations.
Operations.
So applications that were submitted. LSW 2, CSW 25, LCSW 33. Renewals, LSW 15, CSW 8, LCSW 6. Temporary permits, clinical, 3. Non-clinical, 1. Supervision contracts approved, 73.
Well,
0 were deferred. I approved 2 provider CEUs, and 3 sponsorships.
All right, good.
And we have a total number of active licensees, 8,585.
Ouch. Keep growing. Keep growing, okay. Any questions? for- Motion to accept the operations report from staff.
So moved.
Second, thank you. Any questions, any discussion? All in favor of aye?
Aye.
Aye.
We'll be working on the annual report. We'll be working on that. We still have some, I know, issues with the licensing system that we're working out with Tyler Technology. It's gotten a little bit better. We've identified some of the issues and they, as I said at the last meeting, that they are fully committed to making sure it works properly for us. We probably will submit at some point after we make sure it's all working properly. It's, if you've ever been through, you know, I'm sure all of you have been through some kind of a transition from one system to another. Best laid plans always look good until you actually pull the switch and do it, and then that's when you find out, oops, and we're still in that, so we're, you know, unfortunately, in that, and we get it resolved. One of the things that, is not in this system that is, we can ask for the feature to be added, which will be an expense that will, we put in, I think we requested already, didn't we, Mark?
Yeah.
About the CEs, before you could put your CEs in ahead of time. And then it would, when you renewed, it would pull all of those in. Whereas this system doesn't have that piece. It just, when you renew license, that's when you list all you enter all your CEs at that point. Which means before you renew, you have to keep your own list somewhere, which I've always done anyway. Some people, I never used that feature, some people did and they liked it, so we will have to get an amendment to that to get it done.
We need a new self-service portal.
Sort of, yeah, that won't, see, the problem with the old self-service portal was that the day you started your renewal, anything you put in it didn't come over.
Right.
So we have to make sure that the new, if we do it again, that whenever you renew, it always goes over there and grabs everything, regardless of if you started and then you put something else in there later. That was the problem we were trying to resolve because we had people missing CEs and go back and find them and all that stuff. So the new one didn't have that, so we had made the choice, well, we just do it one way because that's the way the software works right now and add the feature later, when we got that came through. So that's not like it's never gonna happen, but and you know, for some people, if they want to list them in there each time before they renew, I think it's a good thing. It's just that we had to make that decision as we got to the system. And, that's a pain for some not, so. Anyway, anything else you need to add to that?
No, I mean, the system works when it works and there's just so many nuances that we had. We just couldn't solve for all of the, you know, issues, which is until we got in the middle of it.
So it's sort of like, you know, so. Anyway, but it is, it's the best news is the fact that our old system, there was no guarantee it wasn't gonna fail again.
Right.
And this system, we have an ongoing maintenance contract that makes sure that it doesn't fail. If it does, it's on them to fix it. So that we don't have to have staff sitting all the time trying to fix it like the last time.
Yeah.
And not having to go through one item by item to figure out if it jumped people's expiration dates. Like there was one in the last time where we had to crash and jump somebody's expiration date out 10 years.
Yeah.
A
A lot of 2031
expiration dates versus 2023.
Yeah.
I mean, I, you know, so. Anyway, We've also initiated, elements within the system to kind of help us get ready for the multi-state license. I'll talk a little bit more about that under the compact item later, so. All right, on to, questions, anybody questions?
I just wanted to ask, how many signed up for the exam credit?
Oh, yeah, I'm sorry. I forgot about that. 70?
100.
I said,
Oh, wow.
oh my God.
I know we had a few, former UPAC students, and they were messaging me during it saying it was such a
Yeah.
good session. They were really enjoying it. So I was just wondering how many there was. Awesome.
I count, I have a 77 then. Oh, wow.
This was a good idea.
Yes.
This was a good idea.
And at the delegate assembly, I mentioned that we were doing it and nobody was
Somebody
doing
had done it.
nobody was doing it, and Dr. D told everybody that as far as she knew, they were lucky to have a board to do this for them at reduced cost, so. I'm glad, I mean, that's like double what we had last time almost.
Yeah.
Yeah, word spread.
So it's gonna be well worth doing twice a year, I think. And again, thanks to staff, and I think it was, whose idea, but Brooke was, what I got was that she got a list from ASWB of people who had failed the exam and reached out to them directly to make sure that they knew what was going on and get them in. So when we do the follow-up, we'll try to break out have you taken the exam first before or last? If you have, then answer these questions so that we can see, we have to wait a while to get them to schedule the exam and try to take it to see if, and look down the road, see if we can, if they, pass the exam, if it helped to pass the exam. Really hope this cohort, more of them take up. The last time, the only problem with that, I didn't get a response that people had joined that study group once a month. That's free to join after you take the course. And for people who have struggled with the test, probably should take it. I mean, they don't have to, but it comes with package. And so I don't think it would hurt for, all right, so we'll follow up on that. But again, thanks for bringing that up to that. Do what? Klein?
Yeah, I'm not sure if this is the appropriate venue or not, but loosely related to supervision and LCSW's licensure. I was posed the question. I want to ask the board about it, and I can follow up offline if not appropriate. But I have a person that was inquiring, the CSW, that was inquiring about wanting to start at 2 different agencies doing therapy, clinical work. One where they wanted to work full time, the other where they want to work part time, 15 hours. And they were asking about how that would work as far as supervision. And I advise, number one, as a CSW, I would not advise you to start 2 brand new clinical positions at once. But I guess I was trying to figure out as far as if somebody were to need supervision for a part-time company in addition to their full-time company, is that even something that could happen? Or how advisable that would be?
It can, the short answer, but let's go back and put that under, we have the supervision reg down later, so we'll discuss that at that point again.
Okay, thank you.
Yeah. Okay, Finance Committee.
All right, so our information for January, our current year-to-date revenue is $225,205.71. And our current year-to-date expenditures is $282,672.94. So of our allocation for the year, which is $838,600, we have spent approximately 34% of our budget. We're 50% through the year, so we're doing pretty good. Our unexpended amount is $555,927.06. And then our revenue and expenditures for December, specifically, revenues were $23,641.46. Expenditures for December were $36,553.80. Any questions?
Questions? Kwan or Whitney, did you get my little email?
Sorry, I would also, the committee would recommend approval for per diem and travel for board members for today's meeting.
Good, and I'd like to, Janessa and I would like to amend that to include our per diem and attending the legislative meeting tomorrow. So
Okay.
that we don't have to wait, do it all again next month. Janessa, Vanessa again,
Take care of it all at once.
all at once, if that's okay to amend that motion.
Is that in regard to the MSL fee? Is that what we're talking about?
In regard to the legislation that we are proposing.
Got it.
So you
We'll
all,
be-
you're meeting with the legislator and other stakeholders tomorrow, is
Yeah,
that correct?
yeah, correct.
I would support that.
Else? Second for the amendment.
Second that.
Thank you. All right. All in favor of any further discussion?
Aye.
All in favor of the- Aye. Okay, thank you all very much. All right. Did you get my email about that I sent Kwan and Whitney? I don't know whether you got it, and Sydney and Laura didn't get a chance to send it to you. I'll send it to you, but just wanted to get this out there to for y'all to start thinking about it on the finance committee. We have to start thinking about what fee we might charge for the multi-state license under the compact. And so this is just a kind of a guide to give you that idea. It has the number at the top with the inputs, what active clinical licenses, masters and bachelors with the fees, and then some scenarios there for y'all to look at. I can send you the Excel sheet, the Excel format if you want to play with it yourself, or just if you want to use this as a guide. You can bring it back in some future meeting about what you would suggest for us. Is basically people who are out of state right now, which I've got that number down there. Under the worst case scenario, the people who are currently in our system who are licensed out of state, will they renew their license in Kentucky once they have the opportunity to get a multi-state license, which means loss of income for us in that 3-year cycle. So do we want, is it a matter for us? For us, we do have extra income right now. Do we need it? How do we value that? Is it, right now we have a different fee for each level category of license. Do we do the same thing for the multi-state license? Because LSW would be, in our state, would be eligible for a multi-state license. So just some thought for y'all to consider. And I'll get this to you, Cindy and Laura, so y'all take a look at it too. So it's kind of
Hank, the one thing about that I didn't really understand is why we might lose current Kentucky resident licensees.
no, it's not current Kentucky licenses, people who are licensed in Kentucky but living
That are
out of state.
Okay, I caught that part, but there was another piece that was confusing, and I think maybe I just misunderstood. I thought it was also saying we might lose residents from some Kentucky residents who are licensed.
Yeah, no, we should, yeah.
Okay.
So. Anyway, there are states who are extremely concerned about losing money in issuing the license, and from what some scenarios I've heard is like, yes, if they don't plan ahead, they will lose money. And then some states, unfortunately, are capped on their fees that they can charge. And at the delegate assembly, one state, that's in our 2 states that are in the compact are capped by statute. Which case they would have to change the law. So how they're looking to help how the compact writes the rule about the fees to help them out. We don't have that issue, but again, we would need to look at whether or not we're gonna lose how much and how do we afford that, and do we do that without making the license too costly? The same scenario was run by some other states and came out as a pretty significant high fee for the multi-state license, like in one instance, $3,000. I don't think anybody's gonna pay that. So You know, but again, the way their licensing and fees are structured, it made sense. I go, well, we've got to figure out something. So ours is not dire like theirs. So thank goodness, but it's like, wow. So the compact wants to be working with the states to make sure that that they can really deal with that. Because that's a real issue. Because as I've told you before, when we started, the compact's like, it's an unfunded mandate. So. Major
Hank?
issues. Yes, sir.
So just to get clarification, I'm looking at the form, and I was a little confused on a couple points also. But it says like required MSL fee per year. Does that truly mean per year or per renewal cycle? Like per 3 year?
Which line are you on? I'm sorry.
It's the right in the middle, required MSL fee per year under results. And it says 336 for best case scenario.
Right, that would, right, it would be, that would be based upon, that would be a 3-year fee.
Okay, so it should probably be per renewal cycle then, as opposed to.
Right, that would be per renewal cycle, yeah.
Got it. Okay, because that's where I got kind of hung up on. I was
Right.
like, well, it's going to be a lot if we multiply that by 3.
No, that's for 3 years for us. That would
Got
be for 3 years for us. If you look back at the top on the inputs, the trick on this one, or the way to start it out, is that it's based on like a 20% of your residents are gonna get the multi-state license.
Got it.
That's what those numbers. So obviously, if the percentage goes up to 50%, the fee can go down.
Okay.
See what I mean? So.
Like buying in bulk.
But yeah, right. So, and that's what everybody has to kind of look at is what number of your current resident licensees are going to get it to set that. And then do you take off everybody who's living out of state? That's the worst case scenario. If you had a low number of people taking it up in your state and a high number of people leaving or not renewing in your state because they don't live in the state, because you have to declare your home state where you live is going to be your home state license to get the multi-state license. So it's gonna be difficult, not as difficult for us to come up with something that.
Do we know, is there
Go ahead.
any, one thing we may not know is there any situation where it would be more cost effective, like if they only practice in their home state and Kentucky? Is it possible that it would be more affordable? I guess it would depend on what fee their state sets for the multi-state license. It could be more affordable for them to just keep their Kentucky license, their home license, and leave it alone. It'll just
Right.
depend.
Exactly, right, exactly. It'll depend on what their home state says for that multi-state license. They go, hey, I'm not gonna practice in 30 states. I'm just gonna practice in my state in Kentucky. I'm just gonna keep that, and they have that option, sure.
So that's a variable that is really unknown that we can't
Yeah.
really control for because we have no idea what every other, and like you said, some states have a cap. Wasn't one state they can only charge like $1 or something for there's
Yes, it
something
is.
really low.
Correct, $1.
Yeah.
For
So
all the home state licenses right now, and the way they say it's written, it seems like it would also apply to the multi-state license, which would be like, wow, I'm thinking, how are they gonna operate very well over the last few years if the legislature required it?
as a state,
I don't
we're
know.
going to have to pay to participate in the compact. Is that correct?
No,
We're
no,
not.
if you look on here, if you look down, that's why I want to make sure you look down where it says compact fee. The compact is looking at charging just a fee, kind of like the counseling compact.
Okay.
Instead of assessments to the states, it would be a fee per license that would go to the compact to fund the compact.
That's probably more equitable because if a state has a whole lot more, they're charging them by the head as opposed to everybody paying the same amount, and that's
Right. Yeah,
Okay.
yeah. The law does allow the compact to assess the states, but the compact's already kind of going, we ain't doing that. If we could do the compact fee like other compact, I think site compact started out assessing the states. I don't think they are anymore, but counseling compact is the first one in my nearest neighbor as far as getting started, and they're doing a per license, for them per privilege fee. Which ours is a little different on that, just to let you know. It's like for counseling compact, they have a per privilege. So if you live in Kentucky and you wanted to practice in Ohio, Tennessee, and Missouri, you would pay 3 privileges. That's how theirs works. Ours, you pay it once, you got all the states. So that's, it's hard to compare too much because of that difference, but our model is different, so, but, you know. So, but at least their compact is not, they really don't want to go down the road of assessing states, so, you know, because that would, per license, I think it's the best approach, and they're looking at $20 or $25 is what the finance committee has already come up with as, you know, again, not to make it too onerous on everybody to pay a lot. For the compact's fortunate to have ASWB backstopping the money for the compact to operate on. So however long ASWB does that can allow the compact to operate and not be a burden on states or licensees to get the license. So that's kind of the background.
So the $25 is in addition to the MSL fee and their state license that they're paying.
You would have it's like you could have LCSW, you pay the $200 every 3 years. You would also pay the licensing, multi-state license fee for every 3 years. And within that multi-state license, out of that would come the $25 that goes to the compact.
Oh, I see. So it's not an additional 25, the 25 is factored in.
No.
Okay.
Yeah, we would set the fee that would include both. And then,
Okay, I'm tracking now.
yeah, okay. All right. Now, it's important to understand how that works. Otherwise, the money side of it can impact us more so than we want it to if we don't look at it ahead of time and go. And again, if y'all have any recommendations for this board, then we want to talk about it as far as what the fee rule should look like. Because it hasn't been written yet, so we need to, if we have any input, then let me know so I can represent that to the.
Is this a typo on the required MSL fee under the conservative case where it says $3 for the clinical? Should that be 300 maybe?
Under the masters,
No, under the clinical.
under clinical.
Because I'm seeing bachelor's is 134, master's is 205, and it says $3 for clinical.
Yeah, that doesn't, I think that's a typo.
That might be, I'll have to look at that.
I was like, that sounds great. Let's go with the, let's go with the
Yeah, right,
consensus.
yeah,
I don't know how we're gonna afford it.
yeah, right, yeah, anyway. Okay. All right, anything else on finance? Oh, moving on to applications.
I think Sydney's taking that.
So,
Yep.
okay.
So we have 4 applications for review from 2 of which were deferred from last time and then 2 were new ones. So application 1 was one that was deferred from the December meeting. We just needed a little bit more information showing they completed their probation, which they supplied. So application 1 is approved. Application 2 was the same scenario. We just needed that documentation that they completed their sentencing, and they did, and they provided that to us. So application 2 is also approved. Application 3 was a new one. This applicant just had a few minor drug-related charges, and they provided proof that they completed all of their sentencing and their probation. So we went ahead and approved that one, and the charges were from several years ago. And then application 4, they had some charges that were quite old, and they have made some excellent gains since then. We just need some proof that they completed their probation associated with those charges. Talking about the late 90s, so pretty old, but we still need the proof of that. So we're just requesting to defer that one until we can get the additional documentation that they completed their probation.
Okay, so the recommendation from the committee is a motion to approve for testing 1, 2, and 3 and deferral in full.
Correct.
Okay, any questions? It's a combined motion, so it's not one at a time, so make sure. Okay. All in favor?
Aye.
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 Okay, thank you.
Sorry, I was a little late to pushing my mute.
Yeah, right. Right, good job. Thank you, Applications Committee. Complaint Committee, I wish we could do the combined motions too. but we got,
That would be
you know,
nice.
That would be nice, but one at a time, and we got some things for you.
Okay, so we have, well, I guess about 7 things to report on today. So not a super heavy month, but have a few things. The first one is case number 25-111. The alleged violation related to ethics and breach of confidentiality. In this case, the committee found insufficient evidence to support the alleged violation and recommends dismissal.
The social worker is a supervisor for an agency and was not the direct provider. And obviously, as director has access to records, so it's in the informed consent and all that, so. That's why it's insufficient evidence. Social worker violated it.
Any other
Questions?
questions about it?
All in favor of dismissal?
Aye.
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 Okay, case number 25-1112, the alleged violation is practicing without a proper license. This case involved some question around a temp permit that had expired and some questions about that situation. So in this case, the committee recommends to have further investigation of the initiating complaint by the contracted investigator and would seek the board's approval for authorization of the expense. We just want to get a little bit more information because there were some details that were unusual in this case.
The employer made the complaint, correct?
Yes.
Yeah, okay.
Yes. Mm-hmm.
Question? All in favor of the investigation?
Aye.
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 Thank you.
Okay, case number 25-113, the alleged violations was dual relationship, and the licensee did acknowledge a dual relationship, but there were just a little bit of murky details about how things unfolded. It does involve a romantic relationship with not a client directly, but a person in the client's family system. So kind of one of those dual relationship situations. We'd like a little bit more information. So in case 25-113, the complaint committee moves to authorize further investigation of the initiating complaint by the contracted investigator and seeks the board's authorization for the expense.
Question? All in favor of investigations?
Aye.
Aye.
Thank you.
Okay, case number 25-114. There was an alleged violation of client abandonment and ethics issues. In this case, one of the critical issues is that the provider is an employee of an agency. And so we sort of discussed that if a person's in private practice, the client is solely their client. If a person works for an agency, the client is actually the client of the agency. And from the information we had, we could not identify issues that appeared that the social worker had. We did not find evidence to support the complaint. So in case number 25-114, the committee recommends dismissal due to insufficient evidence.
Questions?
I have a question on that.
Yep.
Do we delineate between, like when we say agency, like are we talking like a community-based agency versus like a private practice agency? Whereas like, although there might be individuals that are private practitioners, but they're still an umbrella agency? Are we?
Yeah, okay, we try to make that distinction all the time, because if you got a group practice, like your.
Right.
Versus like, say, a community mental health center or other kind of agency versus. You got a group practice, you have to determine whether or not they're all independent contractors within that organization, in which case they're more directly responsible for their clients versus the agency. Does that make sense?
It does, and I guess that's where I was trying to figure out, in this
Yeah.
situation, is
This
this
was
not that?
Not that, no.
Okay,
The licensee was an employee of the agency.
gotcha. So not a contractor, an employee.
No,
Gotcha.
contract.
Okay, I'm tracking.
Okay, good question, though.
Yeah, really good question.
Yeah, good question. Thank you. Any other questions? All in favor of dismissal? All right,
Aye.
Aye.
thank you.
Case number 25-116 related to an alleged violation of ethics and confidentiality and a potential dual relationship. Hank, I am not finding where I made my note about our recommendation. I have the notes about the case, but I
Right.
missed writing my note about that.
Yeah, the recommendation is for investigation, that would include, referral to KPRN.
That's
Okay.
115. We
115.
skipped to 116. We skipped 115, I think.
That's,
Oh,
that's,
I'm on 115.
I keep doing that. I do have notes about 115. 116.
Okay.
Oh, never mind. I'm sorry. I'm just not looking at my notes well. Yes, this case. Sorry about that. 115. It appeared there could be some impairment in the practitioner. And so, yes, case number 115, the committee recommends further investigation and authorizing the expense for that, and referring the licensee, or recommends an order for the licensee to submit to an evaluation of fitness for duty to practice to be paid by the board. So we would like to have an evaluation by KYPRN, or kind of they could help us find a provider who could do an appropriate evaluation for fitness to practice that the board would cover the cost of, but also just further investigation of these details.
Yeah, it's a dual expense kind of one we have rarely, but once in a while like this. So we have an investigation for the complaint piece of it, but the part of that is the expense of getting the evaluation. Again, the complaint was filed by the employer.
And we did know this is a very unusual situation. We sometimes require people to have evaluations for substance use issues or potential substance use issues. It's not very common that we would require this kind of thing or ask for it. So I just wanted to point out that we recognize it is probably a large expense, but we do think that it's warranted for public protection. And it is a unusual kind of situation.
On favor of the expense? Aye,
Aye.
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 thank you.
Okay.
Bill
now-
on 116.
Yes, and now I see the rest of my notes. Sorry. Okay, case
Okay.
number 2516, the alleged violation had to do with ethics and confidentiality in a dual relationship. Essentially, the licensee allegedly engaged in some inappropriate boundaries with the client. And in this case, the complaint committee recommends further investigation of the initiating complaint by the contracted investigator and seeks the board's authorization for that expense.
Several of those this month. All right, all in favor? Investigation? All right.
Aye.
Aye.
One more.
Okay, are there one or two more? There's
Yeah,
25.
it's 2602 and then 2514, whichever one you want to go to.
Okay, I have 2514. The alleged violation related to an LCSW employing CSW's as contract employees rather than employees, which and they have acknowledged that that's a violation of our law. Mr. Bringelman, our counsel, has negotiated with, I'll turn it over to you if you'd like to speak about the settlement.
Yes, this is Mark. We have a written settlement agreement for approval by the full board. As the board member specified, an LCSW supervised CSWs as independent contractors when the law requires them to be employees of the agency. The remedy was a $500 fine, written admonishment, and a prohibition on having supervisees until the date specified in the settlement agreement. So this would be a disciplinary action. So the complaint committee's recommended adopting the settlement agreement as an order of the board.
Questions? Plus, okay, Quan.
Similar to my last question, this was an agency employing having contracted CSWs and not employees.
Correct.
Okay.
And the owner of the agency is the LCSW, who is also the supervisor.
And okay, so this differs from an umbrella of private practitioners, or this is that.
This is a private practice, but
Oh.
person, yeah.
Yeah. So this is a private practice that has contracted people that should not be contracted because
Correct.
they're not independent to be licensed independent practitioners. Track.
Correct.
Okay.
Right, okay. And the only plus to this was the fact the person turned themselves in. Of course, the CSWs we've already done those cases, they had to get contracts and whatever we, so. Any other questions? Okay, all in favor of approving the settlement that Mr. Greenland says negotiated? Aye,
Aye.
Aye.
thank
And
you.
then finally, I had the two cases 2120 and 2162, and I had a note to please turn that over to Mr. Bringelman to give us the background and explanation.
Okay,
Yes, the next cases are involving the same respondent, case number 202120 and 202162. We have a recommended order of the hearing officer to close the case, but it turns out the individual does still have a license, may still be practicing. You need to reject that and direct the hearing officer to hold a pre-hearing conference and get that train back on track. So the recommendation is to reject the hearing officer's recommendation to close it and remand it for a pre-hearing conference and further proceedings.
Yeah. That makes sense. All in favor of not closing the case, referring it back for hearing, administrative hearing?
Aye.
Aye,
Aye.
thank you.
Nothing further, thank you.
And that's all the complaint committee has, I believe.
Well, you had 2602.
Oh, 20, okay. I
Oh,
don't,
yes.
wait a minute.
Well, okay, hang on, let Ms. Brigman explain that one, I'm sorry. The first one.
Case 202602, 202602 is by the same complainant who has complained twice before against the same respondent social worker. The complainant has not been a patient of this respondent social worker for now almost 3 years and keeps filing the same complaint again. So what I recommend to the board is because it's the same complaint again that has been dismissed before, that you on your own, under the inherent authority of the board, dismiss it without sending it to the respondent for a response, but with the dismissal letter, letting the respondent know that the board got this and dismissed it on its own and that no further action was taken.
Claude?
Were any additional details or subsequent information provided this time?
No.
Okay, well, seems cut and dry.
Keep in mind, everyone, that our regulation says the board receives a complaint, they send a copy, the social worker responds. The next case, the board receives another complaint against some other social worker, it's sent to the social worker and they respond. In this case, it's the same individual complaining against the same social worker for the same thing that happened almost 3 years ago now. There's nothing new, and it seems like you've got to do something to break that cycle of sending it for a response, reading the response. If it's the same thing again, the board can just squash it right now.
Do we have an amendment process, like rather than like completing a complete new complaint where they can just amend or appeal, or they have to reopen it every time?
Have to reopen, have to refile, once we dismiss, they
Got
have to refile. But they should, it either has to be a new allegation or new evidence that's come up since we dismissed it.
And that is not the case here. There's no new
There's
evidence.
no new evidence.
Got it.
So the recommendation from the complaint committee is for the board to dismiss it now without further
I do.
proceeding.
All in favor of
That we
dismissal?
dismiss
Oh,
it?
sorry. Yeah, okay, all in favor of dismissal?
I,
Aye,
Aye.
Aye.
okay, thank y'all. All right, I think that does it for the complaints committee, right? All right, very good. Moving on to old business, the first thing is, ASWB updates, and hopefully, everybody has seen this, we can probably put some more information on the Facebook page and the newsletter, but the exam is changing in August. Which is gonna be interesting to see how Dr. D handles this in June. So we probably should have talked about new dates in June, but we'll look at that and do that next meeting, look at some dates.
Yeah.
But anyway, if you haven't seen, go to the ASW website and it will explain all the new, but just the gist of it is the previous formatted exam was in 2018. This is the 2026 format. There are only 3 content areas instead of 4 domains, there'll be 3. The 3 and 4 multiple choice questions there'll be more 3 option ones versus the 4 option ones. The total number of test questions that are the operational questions goes from 150 down to 110. There'll still be 12 pre-test questions instead of 20. At the same time, let me have 4 hours to do the test. So that's the gist of it. If you want, if you haven't looked at it, go to the ASW website. Anybody is prepping for the exam after August, since August, so it's like ahead of time. Of course, everybody who does exam prep are always asking the question, well, how do we prepare for that? It's kind of, I don't know, it's up to you. So when you get that question, I don't know how they do that, but if you're gonna take the exam, when people say, do I wait till after August? That's totally their choice.
right.
So if they don't wanna take the exam now and wait for that one, I don't know, but that's my biggest update from ASWB. I don't know if anybody had anything else that.
Well, one of the things I saw about that, was the movement toward getting rid of those rote memorization questions and
Oh, yeah.
adding more application-based questions,
That's,
which I thought was phenomenal and needed to happen because those rote memorization questions tell us nothing about competence.
right, so, yeah, I mean, that's the biggest shift, other than just the
The
canvas.
format,
The
yeah.
format is for people to realize it's kind of be more of the vignette scenario kinds of things and the proverbial, what do you do first, what do you do next? Are
Right.
still gonna be there, but it's not gonna be, well, does this medication fit with this, be less of those recall kinds of questions that will be there, so. And that's gonna be really testing whether people
is.
can, one, when do you do assessments, when do you, those
Yeah.
kind of things, when do you apply your ethics, cause that's basically, and psychometrics of it, they went from the 4. So it's like, roughly ethics is a third of, each of these 3 areas, so roughly a third of the exam. So, it's gonna be, it's gonna be, anyway. So they've done that. Again, I always, if you wanna be an exam, if you wanna write things for the exam koan, you can volunteer, they take volunteers. And if anybody thinks that it's not a diverse group that does the exam, they got a picture on the website.
It's a very diverse group.
It's a very diverse group that does the exam, so. It's a way to point people that, and again, we need that on that exam committee. Right, and these are all volunteers But, well, if you get all the exams, there's some compensation if you do the training, right? Whitney? I
I
don't
think
know.
I think the question writers get paid.
Yeah.
No, it's the-
Question writers, after you are screening,
Yeah.
you do get some kind of stipend for your time to do that.
And they pay
And
for,
they
they
have-
have separate training, I mean, separate like
Yeah.
gatherings that are in addition
Right.
to the education meeting and the delegate assembly. They have other events they attend.
And, ASW, if you're an exam writing, person, then all those meetings, your expenses are paid for that. So, and they have bachelor's, master's, clinical and advanced, generalist exam, which we don't use, but we could use, but another issue. Anyway, so that's ASWB. And again, for everybody to know, we are, I don't know what our dues now are, what, so I don't know if we pay dues anymore. Yeah, we do. I don't remember, it's gone down so much, I don't know. Finance committee might look that up if you, on the, some point, or have Mark look it up, because it's gone down over it has gone down to, you know, we get a lot more benefit than we pay. You know, so. Okay, compact, we'll explain a little bit about the finance piece of it. The other biggest piece is the data system that has to be set up. So we're in ongoing discussions with the vendor and the rules around it. There's a big concern about privacy. There are some states who do not want the system to use socials. And just as a kind of a balance, when we set up our new licensing system, our licensing system in Kentucky is not based upon the social anymore. But we collect the social to abide by another law and to satisfy ASWB, not because our licensing system requires it anymore. Because we had that in our system and we moved away from that because of privacy concerns, with, data breaches. And that's, so it's on the national level as far as the compact, so there's that debate that's going on to, that the system would not contain, even though states collected, it would not be uploaded to the compact system, unlike some other compacts. So that's a discussion that's ongoing, on that part of it. There are ways not to use the social, just FYI. The compact does have options not to use it. They don't have to use it. It's just licensing system, and Mr. Bringle and Mr. Nichols might know. What I've told is that licensing systems, the history of how licensing systems started using the social goes back to a very interesting problem. It's called child support.
And then student loans.
And then student loans, yeah. Believe it or not, that came from the federal government
Welfare reform.
and welfare reform. So that's how we, you know, so it's just interesting how, you know, but it is a sensitive, you know, because if the licensing system collects the social like we do, we have to pay security for the, in case we have a breach. Of course, ours goes through the state of Kentucky because it's state of Kentucky, but anyway, still on the compact level, the compact would have to pay it, so it is a big expense. The nursing compact is required in their law, believe it or not required in the compact law that we collect the social. Doesn't require that the compact collect the social. And there's probably a good reason because of the history and the privacy concerns, so. All right, good deal. Any questions on the compact? No, come on, somebody ask, when are we gonna have the first licenses? And what's the fee? We already got the fee part talked about. When are we gonna have the first
$3.
license? Yeah,
Okay.
whenever we get the data system and everything resolved on payments and stuff, that's when we're gonna get it. And as you know, we just talked about the complication with fees. Here's the complication with the data system.
Do they have a goal? Do they have like a goal?
Oh, we've got a goal. We've got a goal. We would, as soon as possible, which means, we would like for it to be done and by the end of this year. That's our goal. But with,
It'd be lofty goal.
it was a lofty goal.
Yeah.
Of course, the CSG put down on the website that we would have it done last year, next fall. It's
I
like,
remember.
what?
Yeah.
Anyway, so just so you know, it's probably, I always tell people, I go, well, getting it done by the end of the year, that's iffy. I would love to, but I'm just telling you that it's
It's not likely everything will
not
fall into
likely
place for
gonna
that, yeah.
get in that place. We would be, if we were lucky, we'll be doing it early 27, which gives us plenty of time to do our finance part
Right.
and look at stuff. So we, because we'll have to look at regulations and stuff like that too. So as they come along. So anyway, I wish I could give you, like, hey, it's gonna be, but with, we've got to get this data system, and of course, I'm on the tech, but the other piece, we gotta have the security. We gotta be able to do it right to start with, so if we don't have a lot of expense later because it didn't work, because we didn't ask all the right questions first. So we've got a lot of that being done right now. So anyway. The qualifying experience, and Kwan, here you go to, here's your reg. That we drafted this up, and this is what, I sent out the full thing, I don't know whether you saw that, Mike, but this is what Mike has to do for us, all these pages. We're grateful whenever we discuss reg, Mike has to go back and do this format. So I thought, hey, for Cindy and Kwan, guess what? Welcome to regs. This is what it would finally look like before we turn it into LRC. It's not as simple as writing your sentences, but one, you can have two jobs. Like you said, Bill, I don't recommend that to newly starting out LCS or CSWs. They have, in this case, you've got two contracts. Because you're gonna have a contract for each place, most likely. Because it's difficult for one supervisor of record to do two different contracts, because you got two different job descriptions, you got, and because it's 15 hours at the other thing, the supervisee has to understand those hours don't count under our current rate. Okay? If we get to file this one. One of the changes we made was, no, they could count the hours. So this reg, if we can get it through, would help that situation. But again, right now, that's the way it is, that the other full-time job would count 4 hours toward the 150, but the 15 hours of the contract is required, but the hours won't count, which is another thing. You might be paying for supervision, less and then the hours don't count. I'm not sure why you would want to be doing that. And I always tell CSWs when they're starting out, I understand your energy and whatever, but you do have to not forget self-care. And, I had one supervisor call me, and this person was taking a third job. I go, they go, it's like, I'm doing two contracts. I said, I would get out of both contracts and just do one. And make the person get two other contracts on their own and find a supervisor who's going to supervise. And both of the other two jobs, the second was already less than 20 hours, so the hours weren't counting. And the third one was going to be another situation where the hours wouldn't count. So I'm like, how many hours people want to, it's just that self-care issue that I want people to not.
Well, and a few months ago, we had a very complicated application that we had to go through and really parse out with, because they had jumped around with jobs, and some of the jobs overlapped, and some were at the same time, some were not, some were getting, we had to try to determine whether or not they had the hours and the supervision necessary to be able to sit for the license, and it took forever. And we still ended up having to get more information from the applicant, and she was very frustrated that she kept having to give us information. But it causes a lot of problems when it comes to, us being able to give the nod to take the exam as well. It's not as cut and dry.
Right, yeah, right. 'Cause
Yeah.
unfortunately, people don't understand, we have to go by the regs. We kind of like, we can't just go, oh, well, that one doesn't, Kalina says, I know this person, let's not do the reg for this person, or whatever.
Correct.
Don't have that option, unfortunately. Which is a good thing, but it's also frustrating for people who don't do this part of it. Anyway, I wanted to bring this up because, again, read through it again, because this is how we approved it to be filed. This is a serious reg, people. This is one of our, that we have to make sure that we cover all the bases. And Quan, so that you understand and can explain it to people what we're trying to change, but also that, hey, it ain't changed yet, so you can't do it. Because it takes, even after it's approved by the subcommittee, it may take another 90 days for it to go into effect. So it's not really in effect until we get the effective date. So it's kind of like even after we file it, it's not a done deal. And that's the other piece that everybody has to keep in mind, because then they would be in violation of a regulation that exists at the time they did the action. So.
Can I ask
yeah,
a question about it,
yes.
or do you want discussion about it or no?
Yes, please.
I don't have a note about what page it's on, and there were several things about it I really liked.
Yeah.
Well, two things. One is somewhere in there it says the supervisor has 7 days from the date of last service to turn in their supervised document of their supervised experience. The one thought I had is there are situations where it may be their last time, but it might not have been planned. Like you might not know that your supervisee is going to quit their job or disappear or whatever's going to happen. I don't know if that's something that we need to give a little more time for, or just, I think it's written that way because the idea would be when they actually finish their agreed upon time and it's time for the board to receive notification that they're ready to test, and that makes sense. But there could be other situations where a person doesn't actually finish their supervision as planned, and the supervisor may not know that at the time.
I think
Right.
we've talked about that, and I think it's in there, but we need to review it again, just to make sure it's
Okay.
worded the way we need it to cover all those things. We really
Okay.
do. So we do need to review it again before we file it to make sure.
Okay.
Well,
The-
Quan?
Well,
Sorry.
I have a different question, but now I want to piggyback off of Whitney's real quick. So like, would that also apply to like an additional supervisor who maybe is providing group supervision and you're waiting to see if somebody's going to ever come back to your group or not? And they're like, oh, I
Correct.
might come back,
Yep.
but I might not. I don't know.
That's correct. It applies to that.
Because how do you know when that 7-day mark starts? Like if they're
Exactly. Yeah, right. And that's what it is. Kind of like that additional supervisor piece. We put more in here about that. One, that they have to sign off on the contract. Right now, we list them, but we don't have them sign the contract that they are responsible for, like doing the group sessions and whatever. So yeah, review all of that.
Well, my initial question was going back to the example that I posed and you were starting to answer, Hank, was so if this person that I mentioned has a full 40-hour job and then a 15 hours job, they would need 2 supervisors of record essentially. So
Essentially,
Two
yeah,
contracts.
2 contract, 2 supervisors record, unless the first supervisor on the full-time job agrees to be the supervisor record on the second job. But it'd still be 2 contracts.
got it. Because then I guess the question was, in this person's case, the reason I'm even involved was they were inquiring about having an additional supervisor to help expedite their hours, to which I advised, number one, don't do this, like the 2 jobs. But anyways, like I'm just trying to figure out if they they would need 2 supervisors of record and an additional supervisor for probably the first job if they want to do
Right.
that.
Right, they could do that for the first job, but it would be not even applicable on the second job, because that 15 hours is not gonna count their hours. So if they have an additional supervisor, still the hours aren't gonna count. That's the biggest piece about that 15 hours one.
Right. So they're just not getting any.
They're not getting any
Yeah,
of
but
it.
they have to have that supervisor though, or that
Yeah.
they're
Yeah.
not in compliance
They
with
can't
the
do the job, yeah.
Yeah.
I just don't ever recommend doing 15-hour jobs and having the contract, having a supervisor, not counting the hours, and having to pay for the supervisor and it not counting.
Right.
I just don't see the.
The squeeze isn't worth
Yeah.
the juice. And I said, I don't know, like you don't want to have to learn 2 EMRs. You're still learning how to do
No,
therapy.
right,
You're
yeah,
still
yeah,
learning.
right.
I was like, just do one job, or if you
Just
want to
do
have a
one
second
job.
job, do case management or something that's not therapy.
Yeah. Right, exactly, yeah. do something else if you want extra income, but
Right.
don't do therapy because it's just not workable. But again, we're making the change in this reg to allow that, so they could count the hours, but I think still it goes back to how many jobs can you do and keep up with different agency policies and EMRs and all that other stuff, and keep confidences between the agencies, because you're gonna have that. Ew. Wow.
Well, and whenever somebody wants to, tells me that they want to expedite their hours, I always say, it's still gonna take you 2 years.
Yeah.
Right, right.
Yeah. Right, you still have to be licensed 2 years, but, you know, you may have your 150, if you get all in 1 year, you're still gonna have to have supervision.
Right, so I'm
Right.
always like, what's your hurry?
Yeah,
Yeah, but I guess it's 2 years versus 3 years, you know, if you're only getting the 52 hours a week at the minimum.
and that's where it is, the extra hours. And I always say, now, let's break this down. It's 150 hours in 2 years, that's 75 hours a year. Are you, you know, if you wanna get 90 hours in the year, well, okay, but it's still not gonna help you. Because you're still gonna be paying for the supervision hours to finish out the 2 years. Get 75, ain't that your goal? Yeah, I don't mind if you get extra hours, you know, but again, don't overdo it because it's still got the 2 year mark. You just gotta wait for the 2 years.
And they
And then
have to
you gotta
stay in
still-
supervision too, even
If
if they,
the state, yeah, thank you, yeah, I was just gonna say that, they still, if once they get the 2 years, apply for the exam, you're still in supervision until you get the LCSW. Issued, not applied for.
Right, right.
So you're still gonna have 2 or 3 months if you pass the test.
Yeah, that's
So-
true. That is.
Yeah, so yeah, but there's a scenario I wanted to throw out to you all about this rate, and then our W-2 issue that we've talked about already. Okay, I'm a CSW. Mark knows this one already. I'm a CSW, I start my own business. Therapy business. I contract with another agency to be my employer. So that I'm a W-2 employee of that agency to have a supervisor, but I'm operating my own private practice over here and hiring other clinicians.
Are they doing
Yeah.
therapy?
It happened, folks.
No way.
Oh, yeah, it's happened.
Did you say you're doing therapy or you just own the business?
You own
Oh.
the business, but you're doing therapy.
Okay,
But you're supervising, but you're an employee of another agency where
Yeah.
your supervisor is,
And you're a W-2.
and you're a W-2 with that agency, but you're not doing therapy over there, you're doing therapy in your own agency.
so
Yeah.
basically you've had your employer hire your company as a subcontractor, but you're an employee of your own company.
And
So
now you're an
what-
employee of the other company,
On paper.
on paper.
Well, are you the employee of the other company or is your business?
I am. I'm the CSW, I'm an employee of this other agency.
Well, do we just need to put something in the reg says under no circumstances are CSWs allowed to be in private
Well,
practice?
I'll tell you what, I applauded the CSW for their entrepreneurship.
Smart. It's smart. It is.
Ingenuity.
Ingenuity and
It's just not
entrepreneurship,
ethical.
I know. Well done, well done.
It's just not ethical.
I just throw it out to you guys because it's out there.
I mean, you can't be a private practitioner if you're not a licensed independent practitioner. You're not LIP.
Yeah, but does that mean, one of the things that did come out of that discussion was the fact that somebody did, and this is true, so just make sure everybody's clear on this. As we all know, if you're a CSW in Kentucky, you do not have to be doing clinical, so you could do your own case management business or something like that. That would be totally separate. So just so you know, that would be different. So.
And I would imagine that they probably, I wouldn't advise it, but they probably could own a practice and have other LIPs working under them as long as they're not actually actively doing the therapy. But them doing the
Yeah.
therapy is the problem, right?
That's correct. So the question for us would be, are they doing the therapy and billing under their company or the company they work for? See what I mean?
Right.
And that's entirely possible.
Ugh. Ugh,
So I can applaud them for their ingenuity here.
Hmm.
I don't
There's
allow
something for us to think about, though. Think about that, go on, let me know.
I don't like that.
Yeah.
Because we haven't filed this yet, just wanted me to file a review, and when I came across that, I go, okay.
I had one more question about it, Hank. It
Sure,
was the part where it was talking about awarding supervision credit for people who have gotten supervision in another jurisdiction.
Yeah.
And I mean, I thought, I just want to make sure, I mean, it's just so much for my brain to process. And I was like, I want to make sure I'm thinking about this clearly, that it doesn't become some kind of loophole where people go get their supervision somewhere else. And then they are like, oh, but I already have 100 hours of supervision from this other jurisdiction and I want to bring it in. I mean, I also understand that people may move or whatever, and I would not want to hamstring somebody. That's not my point either. I just don't want people to find a way to use this as a loophole. And so maybe that's why the language says that we may approve. I don't know if we would want to strengthen that the board would take it under consideration or will review it or may approve those hours.
it's a good way to word it, we may have to change that wording to say we may review it, in which instead of we just accept it, amendment to the, before we submit it, so.
I'm
Again,
just thinking about that situation in Mississippi where people, and it was not about supervision, but they found a way to go around something by going to another state that had a little more lax regulations and then bringing their license in. And, given what you just discussed, people like to find ways to try to go around. So,
yeah, so,
Mr. Chair,
yes,
the supervision could be qualified by saying the board may approve supervision occurring in another jurisdiction if the standards of the supervision are the same or higher than Kentucky.
sure.
Right, right now, I take it on a case by case basis and I look and see how those hours are formatted and how they're documented.
Was it face to face?
Yeah.
Yeah, before I give a thumbs up or thumbs down.
Yeah.
I mean, the thing that I think was making me kind of catching me is that, I know somewhere else it says basically to be approved as a supervisor, you have to be licensed in Kentucky and you have to meet all these criteria. And this is basically kind of contradicting that, but it's also, I mean, I don't know, maybe not. I just think that's something we want to really wrestle with.
And just for everybody's information is like, I think South Dakota, I think that's the state, anyway, pretty sure it's South Dakota, just this year, or 2025, last year, got a regulation for supervision. Before that, they issued licenses without supervision.
Wow.
Wow, I know that's what you have to look at as far as the nation goes, and that was all part of the big debate about the compact. Because you're accepting a license from a licensee from another state, and you're depending on that state doing their due diligence, shall we say, in preparation for the independent role. And it's not a dead issue because there's still states who may not be in the compact yet because of that issue. They don't want to give up their sovereignty over it. And, on the flip side of that, Mark and I have talked to the lady who does a lot of the research for ASWB. And of all the different regs that she's reviewed, she liked ours as more toward the top of the list as being good. So just FYI, because we had a long chat with her about her, she hasn't done all the research yet, but she was, when we explained how it worked and everything and what we had been through to get to this point, she was complimentary to the state for doing our due diligence on this piece of it. So, again, that's the work of this board. Continue to do that. And again, we don't want to make it too onerous. We want to make it to help people get licensed, get independent, and go on with their careers. Any other discussion? Ask Mr. Nichols to review all of our regs, all of our dates. Make sure that we can format how we do these and when we do these, so that we can get ourselves on a schedule, to know when they're due and back up, to know when we have to start reviewing things, because this one is one of our major regs, unlike the fee reg, there's different levels and we don't wanna mix those up. So Mr. Nichols is gonna be working on that schedule for us to help us out on that.
So to clarify, the current regs are as we spoke, that are based on what we just said for the last 20 minutes or so, but we're updating the regs and they're not updated yet.
Yeah, no.
Okay.
They're not even filed yet.
Okay, so we don't even have an anticipated updated period. Just
No.
let them know as it stands, our regulations would, okay, based on, okay,
Yeah.
I'm tracking.
Yeah, yeah. And the Kawan, that's always the best way to answer people's questions based on it is right now. You can always, after they understand what it is right now, then you can say the board has had discussions about moving or changing this, but that's only after they understand this is the reg right now. And then being able to say, we have no projected date when that's gonna be effective. Even if you do file it, we don't know if it's gonna get approved and put into effect. So it's, all right. Next item is the legislation, and we have a meeting tomorrow, so that we, hopefully will have a sponsor and, can get filed with the General Assembly, but that's all. No changes, there's no changes. It's everything we looked at the last time, so no big issue on that one. And Vanessa has an update for the board retreat.
Oh, yes, the board retreat is the 7th, 8th, and 9th. We are confirmed to have it at U of L campus on the 9th, the official meeting. I put calls into several places that hadn't responded back to me, so I'm waiting on a call back from the golf house down in Louisville. They didn't have any really close to U of L. Kawan, if you know any closer, you can shoot me an email.
Yeah.
Are we
If
talking
not,
about the east, which campus are we talking about? Like the main campus or
the
the?
main campus, yes.
Oh, I see.
They said they have more students there, so that's the campus we went with.
Hmm.
But I figured we have to drive there and park anyways, so I figured the golf house wouldn't be too bad. And they're the only one that's been responsive to me.
So Saturday's meeting would be Sunday's meeting, the retreat. You come in on what you won't have to go up. I don't have to come up Saturday, stay overnight. We'll meet at the golf house, that meeting room there for the retreat, and then travel to U of L on Monday morning for our meeting there. Do we probably need to do committee meetings at golf house first before we go over for the meeting?
We can.
Yeah,
You are.
so if applications, complaint, finance, we might want to meet
Yeah.
off and on Tuesday Sunday or early Monday morning before we travel. And then, but parking or anything, your meals, keep your receipts and everything to turn in for the per diem. Everything, okay?
Oh, hang on. So I think I might have been confused on that. So we're saying that we're gonna meet Sunday and then we're also still gonna have our meeting on Monday?
Yes, sir.
Yes.
Ooh.
Ooh.
I was gonna say, I don't think I took off the time from work for that, because I don't think I realized that was what we were doing. I thought we were just meeting on the weekend.
Oh, yeah, no.
No, that's our regular board day.
That's our
We just
regular
try to
board
have
day
it
meeting on
around the
Monday.
retreat, yeah. So we could have it somewhere like at a campus.
Yeah.
Yeah, I'm tracking now.
Sorry about that, but
I mean, worst case scenario, I would be meeting virtually on Monday if I can't get
Right.
off in under 45.
you can't
It's
get
not,
off,
it's under
yeah.
45 days at this point.
right, I was saying, that's what I was just thinking, under 45, so, yeah, you can do virtual on Monday.
We'll have to check on that though. Remember the
Yeah.
last two retreats, we didn't have capabilities to
Yeah,
do that.
no, we'll have to check with U of L, see if we have a internet link in the room where we're meeting, so we can do the. We would need the internet link to do the,
All that.
live, the YouTube live.
I'll work on getting off. I'll
Yeah.
work on getting off.
Okay,
I'll
okay,
figure something
all
out.
right.
What time does the meeting start on Sunday?
9 o'clock,
Okay,
be like 9.
I'll
be like
probably
9.
drive in Sunday morning and
Okay.
come then.
Okay.
Because I'm not leaving my circus with my mother for 2 nights. I'm not doing it.
Okay.
I love her too much.
Okay. It'd be like 9 to 4 on Sunday, and then we usually get together for an evening meal. So
Okay.
where we decide where to go, and Kawan, you can help us with that piece, where you might want to go if we need reservation, check with Vanessa if we need to for all of us. Bring us, you can bring your spouse or girlfriend or anybody you want to, with you for that meal. Of course, you pay for that part, or to pay yours, not theirs.
Once I get finalized on the hotel, I'll email everything to you all. We try to enter and count them, that way you don't have to worry about your hotel bill.
All right, anybody else? Any other questions on Richard? Okay, good deal. Okay, well, under new business, this would be a closed session.
May I say, before you entertain going to closed session, we might do that at the very, very end.
Well, that's what I was just gonna.
Are there any
suggest.
announcements
It's like if
prior
you
to?
wanted to just amend the agenda to go to hold this in advance until we do announcements and then go into closed session. If that's all right with everybody. All right,
Makes more sense.
okay.
Yeah.
All right, any announcements? Anybody?
I got a couple. All right, so y'all heard funny thing happened on the way to the holidays with NASW. They fired a bunch of great people. 5 out of 7 women over 60. They cut out the entire, everyone who passed the first 7 states, the compact gone. Most of the states impacted, red rural states. Barely paying anybody who were doing the dual chapters, and for the record, dual chapters don't work. This was an egregious, horrible mistake, but over a dozen boards are pushing back. There's a lot of activity going on behind the scenes for accountability, transparency, and legal resolution. But here's the best news. The Kentucky board all resigned in protest. So we started the Kentucky Social Work Advocacy Justice Leadership to continue to do some of the things that we've been doing. A lot of that is advocacy. So happy to announce 33 states and counting for the Mental Health Insurance Reform Task Force, and Lisa Wilner just filed a behavioral health parity bill, House Bill 279. So we're going to be like blowing that up and making good things happen. So that's huge. 33 states and counting starting right here in Kentucky. Advocacy Day, no longer calling it Lobby Day, it is Social Work Advocacy Day. Friday, February 20th, it'll be virtual, sadly so. For a couple of reasons, mainly there's no space in Frankfurt. If you haven't been there yet, they've closed off a lot of the hallways, can't get into the gallery. So what we're going to be doing is some really good things virtually, but also we're going to be, and that's Kentucky Clinical Society, Kentucky Association of Social Work Educators, KSWE. We're still trying to find an active National Association of Black Social Work chapter. So those groups will be part of it. Meeting tomorrow at noon if anybody wants to help plan. So good things happening along those regards. And just one last thing, y'all, we have got to help this little Ethan Branscombe here in Frankfurt finally pass his bill to make rescue pets the state pet of Kentucky. This 12-year-old has been trying to do this for 7 years. So we're going to end it on a positive note there. Lobby Day, will be reading a lot about stuff. Follow us on Facebook. We're going to turn it into a 501c4 and continue to kick ass across the state. So I'll leave so you guys can do your secret meeting. Thank you all so much for everything.
Thank you.
Bye-bye.
Bye. All right,
So I need to,
no, hang on a second.
sorry.
You have to make a motion.
Okay.
First,
That's right.
go into closed session. So the motion would be for somebody to move and a second, and we go into closed session per KRS 61-810, and it's written out for you already on, right? To discuss proposed or pending litigation against or on behalf of the public agency regarding Robert Snyder, a former complainant to the board.
So
Second.
Second.
Discussion? Favor closed? All right,
I
Aye.
here, record the time, please. Close the, and, cut off the mic, and the camera.
We've lost sound. This could be a problem.
No,
Close.
no, we don't,
We just need to click
we
it out of
need to,
YouTube.
we need to.
Yeah, close YouTube, right?
Close YouTube.
Yeah, we just need to get out of
Close
YouTube.
Okay.
it. That's right, just close it out, they was won't hear the end of the meeting, we're not obligated to be on YouTube anyway. Just
I'm finding it, hang on a second.
Just close out all the
So we're
YouTube.
in
Yeah.
that. In. Okay, that means we're finished, right?
Yep.
Okay, let me just bring up.